Welcome to the State Council Joint Prevention and Control Mechanism presser. Right now, the pandemic in the world is still in a severe situation, and we are seeing a cluster of the cases in China, so we are still challenged. We must stay committed to the containment measures and the dynamic COVID-19 policy. We must observe the version number 9 guideline and hold those entities and individuals accountable for themselves so as to cut off the transmission of the virus. We must curb the outbreak of a large scale of positive cases to minimize the impact of the virus towards our economy and society. And we must also care for the affected population with measures of ensuring their life needs and job needs. And we ask everyone to get vaccinated and observe the containment measures. Today, the topic is about scientific and precise containment measures. We have invited some guests from the CDC, Tier 1 Investigator Lei Zhenglong, from National Health Commission, the Chief of the Expert Team, Mr. Liang Wannian, from the CDC Epidemiology Chief Expert, Mr. Wu Zunyou, Chief Expert, Mr. Dong Xiaoping. They will take the questions together. Now the floor is open, and please identify yourself before raising the question. From the CMG. In Xinjiang and Inner Mongolia, the newly added positive cases are rising in numbers. In Sichuan, Gansu, and other places, we're still seeing the increasing trend of the pandemic. So, judging by the situation nationwide, what's your take about the trend of the pandemic? Mr. Lei Zhenglong will take this question. Thank you for your question. Recently, China is still wrapped up by the outbreak of the local cases and the imported cases from abroad. In partial places, we are seeing a rebound of outbreak. In Xinjiang, we have seen repeated outbreak, but it's still within control. In Inner Mongolia, the situation is picking up with a decreasing number of positive cases. In Sichuan, Gansu, and Shanxi provinces, we are gradually holding control the pandemic. As to other provinces, they're more sporadic. Right now, nationwide, we're still facing severe situation of the pandemic with multiple places of outbreak and wide coverage. So the risks of the virus are still with us, but they are within control. The National Health Commission and the CDC are stepping up their coordination by guiding different localities in implementation around the National Day holidays. We have also intensified our support of Xinjiang, Inner Mongolia, Yunnan, Shanxi, Tibet, and other places. And also we must hold full parties accountable by observing the principle of staying true to the facts and reporting regularly. We will do our best to curb any scaled-up outbreak. Next question. From People's Daily. Based on the disclosed information, we are seeing a rapid transmission rate, but most of those reported cases belong to the asymptomatic carriers. So people are suspecting, why can't we coexist with this virus since they're very mild in terms of the symptoms showcased? Why are we still observing the dynamic zero COVID policy? Mr. Liang Wannian, thank you for that question. First of all, I would love to dig deeper into the concept of the dynamic zero COVID and several key factors behind this policy. In effect, the Chinese government implemented the zero COVID policy based on the people-orientedness and the principle of putting people's life first. So the principle of fighting against any pandemic in any country should be based on their philosophy of pandemic containment. That's the first thing. And second of all, given our understanding about the features of this virus, especially the variation and the change of the effects, as well as the basic background of the disease, we believe we are capable of controlling it, but we cannot guarantee that no one case will occur or we can eradicate this virus once and for all. So the general principle is the dynamic zero COVID, and the core is to cut off the transmission instead of eradicating the virus or allowing no one case occurring at all. And the center of cutting off the transmission is rapid discovery and rapid control. To put it simply, the core of dynamic zero COVID is to cut off the consistent transmission of the virus within a certain community and avoid it from being scaled up or rebounding. If we can accomplish that policy, then we must pay attention to two keywords. One, rapid speed, rapid discovery, rapid treatment. And second, precision. We must have precise identification of the pandemic and precise categorization of the different risk places and precise management and help of the affected people, and also precise diagnosis and treatment clinically. Finally, precise treatment of the containment policy. So that's about the concept and the core elements of that policy. Secondly, to measure the implications of a disease or a pandemic, there are two dimensions. A more worldly accepted angle is to take the perspective of the masses, and the second angle is to take the perspective of individuals to measure the disease or pandemic. Generally, we will take the position of the masses when we are judging the implications of a pandemic. And there are some commonplace indicators of the hazards or implications. For example, the mortality rate, the morbidity rate, instead of some individual indicators. That is quite important. The individual-based mortality rate should look at those infected population and also the death tolls from this disease. Instead, we look at the death tolls from the infection of this disease. As to Omicron, compared to the previous variants, the fatality rate is certainly going down because of the rapid transmission and the mutation. We are seeing a rising incidence of Omicron. That means there will be a larger number of infected population. And the mortality rate will certainly be higher. Be it the WHO or any member country, when they're judging the implication of a pandemic, that ratio is paramount. When a pandemic is occurring, it affects not only the affected population, but also it may lead to some other problems. For example, the squeeze out of medical resources. Then that will undermine the fulfillment of other medical needs. And there might be more death tolls from other reasons. So scientifically, to measure the implications of a pandemic, especially the deaths from other causes, that should be accounted for. For example, this year, the total death number shall be compared with the previous 3 years. We might measure how much more people are dying because of this pandemic compared to the previous 3 years. If there are no other causes to be accounted, then we may conclude that those additional number of deaths are because of this pandemic. And Omicron leads to a larger number of additional deaths. And it's said to be about 100 per 100,000 globally. Thirdly, China is highly populated with a larger number of the elderly. The elderly people stands at about 267 million in number. That's a large group of population. And a lot of those people are suffering from underlying diseases. So those people belong to the highly risky population from the pandemic. Once infected, the probability of having severe symptoms or even death cases will be much higher. China has an ultra-low infection rate. And because of the vaccination, we have capability of immunity. But because of the variants, we cannot drop the vigilance. So if we drop the policy of dynamic zero COVID, there will certainly be a large number of infected people. For those elderly people and those suffering from underlying diseases, it is highly likely that there will be a rising number of death cases and severe symptoms. We cannot tolerate that coming. That's why we must do our utmost to curb it from transmission. And then, from a scientific perspective, what will be the next variant of the COVID-19 virus? What will be the implications of the new variants? We cannot answer that question. But one thing is for sure, the virus will keep changing. That will be the new normal. Besides, the variants of Omicron will certainly not be the last one variant of COVID-19 virus. That's huge uncertainties. With such large uncertainties, we're committed to the available containment measures and the dynamic zero COVID policy. And they are well proved based on the last 3 years of experience. They are effective and scientific. We must take such definite measures to rise up to such uncertainties of the variants. Last but not least, we must fully consider the long-term implications of the disease. Scientists from many countries are putting their sights on the after effects since infection. According to some researchers, a certain proportion of the infected population might suffer from fatigue or cognitive disorder and some other after effects. So how long will the effects last? We don't have a scientific idea yet because it's different from any influenza or any well-known diseases. Because for the latter, we are crystal clear about the after effects, but not the COVID-19. So based on the above-mentioned considerations, we are observing the dynamic zero COVID policy, and it's a must. Thank you. Next question. from the CMG. In the previous presser, we've heard a lot about the Mid-Autumn Festival and the National Day holiday containment measures. And it lasts from September the 10th till the end of November. We are approaching the deadline. What about the containment measures ever since the end of that period? Mr. Lei Zhenglong. Thank you for the question. Because of the people flow and high risk of transmission of the virus, the Joint Prevention and Control Mechanism intensified certain containment measures during the two holidays. For example, to ensure the orderly and safe traveling, we are encouraging the nucleic acid test upon arrival and the effective examination of the reports of the tests. Those measures will be helpful for early discovery of any potential outbreak and under the precondition of dynamic zero COVID, we have measured the effects of those policies and we have fully considered the variants of the virus. That's why we keep improving our containment measures and coordinate the pandemic prevention and control and economic and social development. Thank you. Next question. Thank you from the Economic Observer. We're in the third year of the COVID-19. Many countries in the world are setting loose on the containment measures. Are we under pressure of following the same policy? Mr. Wu Zunyu. Thank you for your question. Dynamic zero COVID policy is the general principle of controlling the transmission of the infectious disease, including the COVID-19. In the past 3 years, the Chinese mainland have witnessed over 300 imported cases leading to local cases, and those situations have been well controlled. Practices testify that the dynamic zero COVID policy is scientific and effective significantly, and it lives up to the actual conditions of China. That's why we stay true to that policy consistently. From the highly risky places to the low risky places, the transmission of the infectious disease is just like the flow of water. That's only natural. Ever since the well control of the pandemic in Wuhan, China was hit by the transmission of virus imported from elsewhere. That's why we have paid close attention to the general strategy of curbing the imported cases and the rebound of domestic cases. And we have seen that this strategy is very useful. Next question, please. From Xinhua News Agency. Even some countries are seeing a rising number of newly added cases. Mr. Liang Wannian will take that question about why can't we just give up our containment measures, just like other countries. Globally, the majority of countries' containment measures have changed to only preventing the death cases and the squeeze out of medical resources and severe symptoms. The general practices are as follows. First of all, multiple countries have loosened their limitations of inbound. Secondly, partial countries have also loosened their policies of socializing domestically. Thirdly, some countries no longer executed the mandatory isolation measures. Some countries do not voluntarily suggest nucleic acid test in order to discover the newly infected people and trace their traveling history. But in general, the majority of countries in the world are still reinforcing necessary protective measures. For example, wearing facial masks, keeping a social distance, and in the meantime, implementing the policy of vaccination, which is usually prioritized. There are several reasons behind those strategies. Those strategies have been optimized, of course, for example, based on the containment ideas of various countries, and second of all, based on their capabilities of containment and conditions. Thirdly, based on their understanding of the features of Omicron, for example, the faster transmission. Do they have any institutional insurance or mobilization capabilities in face of the fast transmission of Omicron? That matters. Personally, I think some countries readjust their policies only as a proactive reaction to their conditions. Take the US and Japan as an example. They have loosened their containment measures, and they have brought up several rounds of new outbreak. There might be even a larger number of additional deaths caused by the pandemic. But China is persistent on the dynamic zero COVID policy, and we still highlights that we put people's lives first and we are people-oriented. People's health are valued. And more importantly, right now, China is capable of realizing the dynamic zero COVID with preconditions allowed. In general, locally in China, we are clean. So the majority of the positive cases are imported elsewhere. If we can do a good job in terms of curbing the import cases, as long as we can have early discovery of the imported cases, we can manage the execution of that policy. And the past 3 years have fully proved that point. Why? China has strong mobilization and organizational power. We have our own strength, and the Chinese civilians have high sense of responsibility, and we are cohesive. We observe the principle of collectivism, and we take full use of the information technologies. In our health system, we already have some prevention and rescue capabilities. Meanwhile, we have some material guarantee because we can strike a balance between the containment and the social and economic development. Those can all explain our good starting points of implementing that policy. With the condition and the capability, we are committed to dynamic zero COVID. We would love to minimize the impact of the virus and to win the final victory against that virus. If we want to copy the policy from other countries, the end of the story will be a large number of infections and a large number of severe symptoms and death cases. That's against the Chinese culture and our spirit of fighting against the disease. Thank you. Next question. From the paper. My question is, as we all know, the virus has been mutating. The version 9 guideline is still effective right now? Mr. Dong Xiaoping will take the question. Thank you for the question. The mutation of the virus is natural. First of all, we tend to believe that there is no need of readjusting the guideline. The version 9 guideline has covered different stages of our containment. For example, public health policies, including education, vaccination, exercises, and sanitation. And also it includes the lab testing, the virus monitoring, the key stage prevention and control, with a series of scientific and pragmatic requirements. After several months of implementation, the major technical means and measures are effective in responding to the Omicron virus. So, as long as there is no new big variant, for example, like Delta and Omicron virus, and no occurring of any new coming capabilities of mortality of the virus, this version 9 guideline is still feasible and effective. Thank you. Next question. Thank you. From the Dragon TV. Under the circumstance of the zero COVID policy, how can we maximize the benefits to the resumption of production and work, and how to keep the implementation of that zero COVID policy steady? Thank you for the questions. First of all, we must increase the precision level of our containment measures. We ask localities to take precise measures. We cannot simplify the procedure of containment, and we cannot just allot a large number of places to be risky places. We must not undermine the office work. So we must have precise allotment of the different risk level places, and based on any change of the pandemic, we must dynamically readjust our policies. And we must offer convenient services to people's traveling and life and work. For the catering business and schools, we must intensify our monitoring to minimize the impact of the pandemic over economic and social development. Secondly, we must reduce the impact towards the civilians. While emphasizing precision, we must render warm services to the population. We must ensure the necessity supply and medical needs are met. We organize the neighborhood committee and the property managers and other volunteers to offer services to the civilians in order to deliver warmth to the people. We also call upon civilians to establish a correct legal awareness. Third, we guide different localities in implementation. We guide localities to fully execute the different requirements and policies in version 9 guideline, and we offer some training services to the localities so that they can strictly honor their commitments to the guideline. And for the prioritized industries, especially transportation, trucks, and passenger cars, while curbing the transmission, we must also ensure their normal operation of the whole industry. Thank you. Next question. Thank you. Many cities this year are rolling out regular nucleic acid tests in order to have early discovery and response to minimize the impact over the civilians. What is the outcome right now? But in some places, even with that, they are still unveiling the management of the static management on a large scale. So how to strike a balance between the two? From Hong Kong Economic Herald. Thank you for the questions. The prevention and control must have 4 pointers. Early discovery is the first step, and nucleic acid test is an important means to realize early discovery, especially when we are given a conclusion about the infections. It is a golden standard. Global experience has proved that nucleic acid test is highly sensitive and specific. So they usually adopt this test as the golden standard of diagnosis. With 3 years of practices and capacity building, China is able with the nucleic acid test services. Every day, we can allow for 100 million single tubes testing. That is to say, if we have a mixture of 10 samples in one tube, we can test in total over 1 billion population per day. That is massive. And in some metropolises, we can set up a radius of 15 minutes walk of nucleic acid test stations. Also, practices have proved that in terms of early discovery, nucleic acid test has played a big role. Many cases are found out because of the regular nucleic acid test. As to the static management policy, we have heard some explanation just then. I just want to add that one of the objectives of our prevention and control is to generate the best benefits with minimized cost. That is to say, we must try our best to avoid static management of the whole region. Static management is not a necessary measure. If we can try our best to avoid static management, then we must hold the 4 parties accountable and have early discovery. If we can realize early discovery, small coverage, and precise measures, then we can certainly do it. But of course, the Omicron variants have certain special features, determining that it's very difficult for us to completely accomplish the task of cutting off the transmission once one case is breaking out. If this one case is discovered later, especially when the infected person has unclear transmission chain and a wide coverage is affected, then we must look at the capabilities of our prevention and control and some other conditions when we are selecting policies and measures. In some places, they may take a certain level of static management covering a certain region. That is also considered one effective means of curbing the transmission as early as possible. Of course, we will try our best to avoid the implementation of that static management, but when necessary, a certain level of static management is an effective means, but we must have early discovery, early diagnosis, and early treatment. Thank you. Next question. From the Phoenix TV. Many countries are forced to give up their containment. As to the confirmed cases, what is the actual situation in those countries? And also, between China and the other countries, have we compared the infection rate and mortality rate? Mr. Wu Zunyo. Thank you for your questions. It's been 3 years since the transmission of the COVID-19 virus. The whole world has been influenced. Judging by the two indicators of morbidity and mortality, then China has been least influenced globally. First of all, let's compare with the US. And secondly, let's compare with the world at large. By October the 10th, according to WHO website, the cumulative reported cases in the US was over 95 million, with a death case of 1.05 million. But in China, those two numbers are 250,000 reported confirmed cases and 750,000 asymptomatic carriers, which make the total infection number to 1 million and a death number of 5,226. If measured by per 100,000 people, then 70 people are infected among the 100,000. That's only 1 per 483 in the US. As to the mortality rate, it's 0.4 per 100,000. That's only 1 per 785 of that in the US. And consider that China's total population accounts for 18.32% of the world's total, but the incidence rate is only 0.06 of that of the world. And if judging by the incidence rate of per 100,000, the incidence rate of China is 1 per 112 of that rate of the world on average. So the death number in China is only 0.08% of that in the world. That's about 1 per 229 of that in the world. So whether compared with the indicators in the US or in the world, China has absolute advantages. That's why we have reasons and confidence about our containment measures. Thank you. Next question. The first BF variant of Omicron has been found. So what's special about this new variant? Mr. Dong, thank you for the question. With any new variant, this question will be put. I have to re-emphasize that the variation of viruses is very natural. It means as a microbial with very simple structure, it's highly responsive to the external environment, even more so with the COVID-19 virus. Even though it has occurred within only 2 years' time, it has affected a large number of population. Even with so many people vaccinated, it's mutating even faster. Since 2022, with Omicron in the picture, the variation of the virus is speeding up. That's natural. And secondly, for BF.7, in essence, it comes from BA.5.1.7. So it's mutated from BA to BB to BF right now. It's actually a derivative of BA.5. Speaking of BF.7, it's been discovered since September this year, and it has become a commonly seen and prevalent virus worldwide. and it takes up about 11% of the total infections by the statistics until last week. And compared to the other variants of Omicron, for example, BA.2 or BA.5, BF.7 is quite similar to those two in the beginning, with similar features, for example, strong transmissibility. But whether .7 will be the most prevailing variant globally, let's wait and see. And in terms of the pathopoiesis, .7 has not strengthened compared to the previous variants. Thank you. Next question. From the cover. According to our knowledge, recently we have seen some reinforced containment measures. For example, we ask those coming from elsewhere to come back. And how can we curb such one-size-fits-all policy in certain localities? Mr. Lei Zhenglong. Thank you for the question. You mentioned that some places are taking mandatory measures of returning those people coming from low-risky areas. In the website of National Health Commission, we have received such complaints. According to the statistics, since October the 1st until 12th, there are several comments, and a large number of the comments are as follows. First, no mandatory returning of people coming from low-risky areas, and the number of the comments account for 30.36% of the total. And secondly, localities shouldn't scale up their sanctions against the people traveling from elsewhere. For example, enlarging the coverage from high and medium risky places to cover low-risk places. CDC and National Health Commission pays high attention to the prevention and control mechanism. We have set up a working team to solve the problem of one-size-fits-all and simplification of the procedure. According to the mechanism, the work team every day will deal with the complaints collected everywhere. We will be problem-oriented and set our sights on those complaints. If any locality objects the policies, we will ask them to recorrect their behaviors. We will ask them to serve people's needs, especially the urgent needs and difficult problems. The work team will be given better play to have quick reaction to people's complaints. And we will monitor and report our working procedure so that the complaints can be properly resolved. Next question. From the Daily Economic. This pandemic has been influencing our economy and society. How can we measure the cost of our containment measures? Mr. Liang Wannian. Thank you for that question. All countries in the world are influenced by the pandemic. Especially this pandemic has been impacting our economy. No one country can be immune from it economically. And one of our objectives of containment is to avoid or minimize such economic implications from the pandemic. Since this pandemic has been with us for 3 years, in the history of the pandemic, in the world that is rarely seen. It has been persistent for such a long time, and it's being transmitted even faster. So, against that backdrop, our containment measures must adapt as well. Inevitably, that will have some influence over our economic and social development. That's why China has been committed to the policy of curbing imported cases and domestic outbreak under the principle of dynamic zero COVID. And we also emphasize scientific and law-based and precise containment. Through scientific, law-based, and precise containment, we hope to minimize the impact of the containment measures on our economy and society. It has been proved in practices that our containment has been effective and scientific. And compared with worldwide, it has the highest cost effectiveness, whether in terms of our economic outcomes and containment outcomes. And we also have effectively struck a balance of containment and economic and social development. To measure the effects of our containment measures, there are several parameters. If judging by cost effectiveness, how can we measure it? How can we measure the cost? That's a very important topic. For example, when we are calculating the benefits, how to get on with it, we must take a dynamic perspective to look at benefits. We must calculate the overall benefits and the overall cost. The benefits should not just be limited to economic benefits and the cost as well. Instead, we must also fit in the implications over the society, people's livelihood, and health. Let's take a dynamic view. To put it simply, we must look at the benefits and cost in general. After all, it's a grand pandemic influencing mankind. From the perspective of public health, in front of such a grand pandemic, within a short period of time, sacrificing the benefits of partial places and the minority of population to get the benefits for larger places and larger population. That is cost effective. So all countries have been balancing the cost and benefits. So their choice will be based on their own culture. Thank you. Next question. From China News Service. In some places, the pandemic has been persistent for a very long time. Especially prevention and control at the community level is getting only complicated. So, what is the priority of community level prevention and control? How can the grassroots level improve their capacity of prevention and control? Mr. Liang Wannian again. Thank you for the questions. Some places have been haunted by this pandemic for a very long time. There are several reasons for it. For example, the features of Omicron, that is objective. Also, in some places, their understanding of prevention and control might not be enough. They might have dropped their vigilance. against the virus. So we must set up our awareness and adopt a stringent policy. Let's implement the version 9 guideline and the dynamic zero COVID policy. The grassroots level is the first firewall against the virus. It takes on several responsibilities. It's also responsible for resuming normal production and life, so the community level is irreplaceable. In our fight against the COVID-19, China has already introduced the grid level management at the grassroots level, and we have taken cohesive measures at the grassroots level to respond to the virus. But undoubtedly, at the grassroots level, there are still some loopholes. The grassroots level is still yet to be improved. In the next step, we must build the capacity of prevention and control at the grassroots level, and we must keep our education among the population at grassroots level and help the population to reinterpret the policies with sufficient material storage so that the first firewall against the virus can be better developed. Next question. It's mentioned that there might be some after effects of the pandemic. So, what is the conclusion from the latest research about the after effects of the COVID-19? From Southern Urban Daily, Mr. Wu Zunyu. Thank you for the question. Speaking of the after effects of COVID-19, it's also called the long-term symptoms of COVID-19. In October 2021, the definition was posed by the WHO. Once a person has been infected by the COVID-19 virus, within 3 months' time, there might be different symptoms ever since their recovery of infection. Or their infectious symptoms might even last for over 2 months. That means there might be repeated occurrence of the symptoms, and no other causes can explain that. That's called the after effect. Based on the research results globally, the after effects have covered a lot of health problems. There are a lot of symptoms, for example, fatigue and cognitive disorder, and polypnea, headache, cough, heartache, joint ache, depression, anxiety, fever, lack of senses. Those symptoms might last for several weeks, months, or even longer. The after effects are commonly seen among the severe cases, and it can also be found in the mild cases. Usually, if you are vaccinated, even infected, the risk of having the after effects will be lower than others. So to prevent the after effects, the best way is prevention and control of the infection. That's why the dynamic zero COVID principle is an effective means of not only controlling the large scale of transmission, but also an important means of preventing the infection. Next question. From Hongxin News, CDC has published China and major countries' vaccination list. So, what is the update about the vaccination in China, particularly among the elderly population above 60 years old, especially about the boosters? Mr. Lei Zhenglong. Thank you for your questions. Up until October 12th, 2022, the cumulative vaccination registered 3.437 billion doses, covering 1.3343 billion population. 1.27 billion population have completed all doses, and they account for 92.45% and 90.2% of the nation's total. 870 population has completed 3 doses. As to the elderly above 60 years old, 230 population has been vaccinated, accounting for 90.6% of the total number of people above 60 years old. 170 people have completed 3 doses among the elderly above 60 years old. Next question. Thank you. From the Health Daily. Now, this is the winter season, and that is the high season for influenza. According to the experts, the pandemic virus has been mutating, so that's like the double kill. How can we respond to that severe situation? Mr. Lei Zhenglong. Thank you for the question. In some provinces, they're still in the season of influenza. And the incidence rate has been higher compared to other time periods. So we must respond to the high risk of such worsening situation. In September, we have been accumulating our experience of responding to the pandemic in the past 3 years. We take scientific and comprehensive measures to make out new plans. First of all, more monitoring. In the labs and in the hospitals, they must play bigger roles, and there must be the surveillance reports from those institutions. The CDC branches nationwide must also do the monitoring work so as to ensure precise containment. Secondly, the provision of the vaccines. There will be dynamic monitoring of the vaccination situation, and we guide different vaccination stations to do their work, especially among the elderly people and the people suffering from mild diseases and chronic diseases. Third, publicity work. In the new media and different media channels, there might be multi-directional knowledge sharing about the virus, so that people will take active measures to be vaccinated and keep good sanitation of their hands, keep social distancing, and let's work together to avoid any new infection. Thank you. In the interest of time, we will allow for 2 last questions, please. From Shenzhen TV. In face of the new variant of Omicron, how can the public be ready? And what are the reminders from the experts? Mr. Dong Xiaoping. Thank you for the question. Let's deal with this variant from 2 ways. First of all, specificity. And the good answer is vaccination. Among the high-risk population, the booster vaccination is paramount. As to the hospitalization, the protection of the severe cases and prevention of death cases, vaccination has proved to be effective. Of course, this variant has its special features, but we have to consider that the vaccination during the transmission years of Omicron has been hugely different from the period of Delta transmission. So vaccination is a big difference, and it must be continued. Secondly, at this stage, we must take non-medication control measures, that is to say, the regular individual protective measures, like sanitation measures. And we must avoid any gathering. That's very effective in terms of preventing the respiratory system infection, especially among the elderly people. Last question, please. Everyone is looking forward to the end of the pandemic and coming back to their normal lives. How long we must fight against the pandemic, and what other preparations do we have to do? From China Review News. Thank you for the questions. We are all expecting the early end of this virus so that we could come back to our life before 2019. All of our efforts right now are targeting at the coming of that day earlier. In general, our containment measures have already made stage-by-stage achievements. We've seen the silver lining of success, but we are not there yet. So we must continue our efforts and do all necessary preventative and control measures. In the final analysis, the eradication or the final victory against the virus depend on the variation of the disease and the infectious spectrum of the virus, as well as the preventative capabilities of our health system and our rescue capabilities, as well as the intervention of the public health system. Those factors must be weighed together, and there are several tasks for us to accomplish at this moment. First, I do believe right now we must cement our confidence and come to the same page and be committed to our general strategy and principle that is significant. We must take good opportunity of this time and insist on the efforts. We will surely come to final success. Confidence is surely more valuable than gold. Secondly, as Professor Dong Xiaoping has mentioned, we must continue the vaccination campaign, especially among the elderly population. That will help to avoid severe symptoms and death cases. Third, we must increase our prevention and rescue capabilities. For example, how to avoid the occupation of medical resources in the hospitals, and how can we ensure quick control when a large scale of cases break out. We must also give full play to technologies. There might be more effective vaccine, there might be more accessible and user-friendly medications, and we must step up our efforts in the provision of those medications and means. In terms of medications, we have seen some hopes already. Besides, we must have sufficient material storage, including the preventative materials and the materials for normal production and life. Finally, quick reaction and precise efforts. We must avoid one-size-fits-all measure. If we can take such comprehensive measures with cemented confidence, we will surely have the final victory. Thank you. This is the presser for today. Our experts have shared with us about precise and targeted measures of containment and have answered your questions of concern. Thank you for your attention, and there will be more pressers yet to come. Please stay tuned with us. So that's all for today. Thank you for watching.